Thank you very much. Welcome again to our podcast today, orthopedic podcast for undergraduate students and medical officers. Our topic of discussion today is a very important topic. It is history taking in orthopedics. Now, in orthopedics. Now, just like any other specialty or subspecialty in medicine, history taking in orthopedics is not any different from these uh, other specialties. However, I would like to stress that we take history slightly differently in orthopedics because our emphases are different. For example, right from the onset, when you see the patient, there's certain demographic data that you'd like to get from the patient. That's the name of the patient, the age of the patient, obviously the gender of the patient. But in orthopedics, unlike in other disciplines where you will take certain data from the family social history, I think it's important that you take some data right from the beginning. And this would be included in the personal history section. So you would ask the patient the occupation. And I think that this really has a bearing and may guide you towards certain aspect of history taking. Later, you want to find out the marital status of the patient, and you also want to find out the residence of the patient. So that's slightly something different if you look at orthopedic history as compared to other histories. And then straight away, you will go to the various complaints that the patients will come with. And there are a number of things that patients may present with in orthopedics. The first is pain, the next is stiffness, the other thing is swelling. Some patients may complain of weakness or instability, or even a deformity of a specific joint. Now, with regards to pain, I think that there is a good mnemonic that really you can use in order for you to remember what you will ask the patient. And this mnemonic really is the name of the famous Greek philosopher Socrates. You want to find out what is the site of the pain, what's the onset of the pain, what's the characteristic of the pain, the radiation of the pain, associated symptoms of the pain, and timing of the pain. And then you want to find out the exacerbating and relieving factors and the severity of the pain. I think that apart from just that, even with regards to the other symptoms like stiffness or deformity, you want to find out how this really affects the patient's life. So, with regards to stiffness, you'd ask the patient whether this is something that's generalized or just localized to a specific joint. You want to ask the patient whether swelling was gradual or rapid. For example, a patient may present with a knee injury, and you want to ask him, when you sustain this knee injury or this problem of your knee that has been giving you problems for a long time, when you initially injured it, was it something that was a swelling, something that came immediately, suggesting a hematoma? Like, for example, if you have a ligament injury, like an ACL reconstruction, or something that came a day or so after, maybe something like meniscal injury. You also want to find out how much this really is affecting the patient. This is important. I think this is one aspect of history taking that probably I was not taught as an undergraduate, but I really learned as a resident how much of this is affecting the patient. And there are certain scores that we have in orthopedics, or outcome scores that you really want we have in orthopedics that can guide you, with regards to history taking. For example, if a patient presents with hip pain, you want to find out really, and stiffness, you want to find out how this is affecting their activities of daily living. I think this is really, really important because that will determine what steps you will take to alleviate the pain, whether you need something drastic like surgery or you may manage the patient in non operative ways. So, a patient may present with hip pain and you want to find out how far they can walk. You want to find out whether or not they're able to rise easily from a sitting position. You want to find out whether or not they're able to use the toilet, because these activities involve moving the hip. Therefore, a patient who's been having arthritis of the hip for a long period or for a long duration will tell you that actually when I sit, rising from a sitting position is a problem. Sometimes you want to find out from the patient, are you able to tie your laces comfortably? And the patient will tell you, no, they're not able to tie their laces comfortably. You want to find out the walking distance. That will be able to quantify how bad the arthritis in the hip may be. So a patient may tell you that, hey, I can't walk 200 meters. That's opposed to a patient who is complaining of hip pain but can still go 5 to 6 kilometers, meaning that their pain is not as bad as the one who can just walk about 200 meters. You want to find out whether or not they're able to use stairs. Obviously, this varies from culture to culture, because like in our culture here, we know not all patients have access to stairs, but you can modify this. Say, what about using a heel, if a patient is from a rural area, and you want to find out whether or not they're able to get in and out of either private or public transport. And you would be surprised that before you ask these patients these questions, they may not be able to volunteer, but once you ask, they will be able to tell you quite a number of things, and you would be surprised how comprehensive your history can be. Now, remember at the beginning, we said you want to find out about the patient's occupation. And one important thing is you want to ask the patient, how is this affecting your life with regards to occupation? Are you able to do your job? Because if a patient is not able to do their job at all, then obviously, their livelihood is threatened. So you want to ensure that, if the problem is that severe, that you are able to intervene as soon as you can. Now, this varies from complaint to complaint. It varies from complaint to complaint, but really the message is the same. If you have a patient with a shoulder problem, there will be different activities of daily living. For example, patients with shoulder problems, may say, oh, they can't sleep well at night, on that side, or they may, say that they cannot reach for overhead activity, they cannot reach, up, cannot uh, adequately do activities that involve lifting the shoulders, overhead, lifting the hand or the upper limb overhead. So you want to find out whether or not the patient is able to comb their hair. Is a patient able to toilet? Because if a patient has got shoulder pain and they cannot internally rotate the shoulder, that would give them problems. And I think that you really need to modify. Obviously, in a short podcast like this, we can't go through each and every single area or system to determine what questions you will ask. Suffice it to say, we want to find out how much is this complaint rendering the patient um, uh, non-functional or dysfunctional. How much are they suffering as a result of this? Not just with regards to the severity of the pain, but what is it that they cannot do now that they were able to do in the past? If you're taking a history of a patient with a hand injury, right off the back, you really must ask, or even a patient with an upper limb problem, you must ask what is their dominance, and that will really guide you. And then, following this, you want to ask past medical history. Past medical history, you want to ask about previous illnesses, accidents, any surgeries that they've had, any medications they're on, because you'd be surprised if you don't specifically zero to this. Patients may tell you that they're fine. You may ask them, well, how is your past medical history? Anything that I need to know? And the patient says, no, nothing significant. But when you ask, have you been admitted before? Are you on any medication? You'd be surprised how much information you're able to elicit from the patient. And then we proceed to the family and social history. Now, family social history, there are certain aspects that you may ask. Certain diseases may run in families, like, musculoskeletal disorders, like rheumatoid arthritis and things. However, sometimes you just want to find out, where does the patient live. You've already established the residence. What's his living circumstance, in terms of how many people does he live with, and whether or not the patient is able to get help. This is important, especially with patients who are old. You want to find out really, what if can somebody help them, supposing they required any surgery. Will somebody be available to help them after the operation, or they need to make special arrangements. And then finally, you want to ask about the social history. And the social history, things like smoking and alcohol consumption. I think smoking is important to ask, because certain orthopedic operations will not be performed if a patient is smoking. If a patient has a foot problem or a back problem, we are very careful to perform orthopedic operations, because the healing may not be very good. And once you do the operation, the patient will forget, that they were smoking. And if you get a complication, it's why did you do the operation in the first place. With regards to consumption of alcohol, you want to find out, is this patient a social drinker, or this patient really has a problem with alcohol, or is addicted to alcohol, and that will affect how much that will affect your decision as to the best way of management. We've already spoken about the occupation, but here you want to find out the details of their work. What does the work involve? If a patient tells you that they work in a hospital, or they work for an organization, is your job manual, or is it an office sitting job? How much walking is involved in your job? And remember, we said, even when you're taking the history, how much is this affecting your job? And then don't forget that you want to also do a systemic review. Really, the gist of the matter, or what we want to establish, is what is this patient's problem? What are the options that we are thinking of with regards to his management, even before we examine him, and how much is this affecting his life? So those are the reasons. I always tell the undergraduates that when you're taking a history of a patient, it's really an evolution from taking the history because you've been told to ask all these various questions, to really zeroing down and finding out exactly what the patient has and how you can help the patient. And that comes with time, with experience, and we're doing this over and over and over again. I think that if you follow these guidelines, really, you will be able to take a comprehensive history that's not only going to be useful to you, but to your colleagues, and will also, throw light to the patient on what their problem is and what needs to be done. Thank you very much for listening. That's the end of our podcast today, and see you again next time.